2025 International Adolescent Health Week themed Thriving Inside and Out, Strengthening Physical and Mental Health focuses on empowering young people to achieve holistic well-being in today's fast-changing world. This year's campaign highlights the vital connection between physical and mental health, emphasizing that true wellness extends beyond the absence of illness to include emotional resilience, self-awareness, and a supportive environment. To discuss this, we are joined by Mrs. Roseline Akinlabi, Adolescent Health Desk Officer, Osun State Primary Health Care Board. Thank you for joining us on Elite at 7.
Good evening, sir. Good evening, our viewers as well.
All right. As an adolescent desk officer, what is your primary role in promoting adolescent health in Osun State?
All right. Thank you very much. Knowing fully well that adolescent age is a critical stage, because this is a stage where you have a girl or a boy transiting from being a child to an adulthood. So as an adolescent desk officer, who is a whole lot of responsibility to sensitize the parents, to see the needs of these adolescents, to even sensitize and create awareness and ginger even the adolescent also, so that their voice can be heard, so that they can also be part of the planning in any health-related matters that has to do with them. So it's a whole lot of responsibility, talking to policymakers, talking to stakeholders and CSO that works in the space of adolescents to also look at programs that we can do to better the life of this one, and so that they can have a better future.
All right. How does your office collaborate with schools, communities, and health facilities to support adolescent well-being?
All right. I will start by even appreciating our stakeholders from other agencies, because adolescent health has now gone beyond an issue that one agency can handle, or even looking at their health is encompassing. So I'll give kudos to Osun Ministry of Education for their collaboration. I'm from Osun State Primary Health Care Board. We work with the Ministry of Health as our mother body to also see to what we can do. So Ministry of Education has been helping in making it easier for us to access school, either private or government schools, because this is where majority of our adolescents are. So it's a kind of a multi-agency or multi-sectoral collaboration that we collaborate with Ministry of Women Affairs at times, collaborate with other CSO, because it's more than one agency can take care of.
All right. For everything that has its advantages, there may be likely disadvantages. What are some of the key challenges you encounter in implementing adolescent health programs?
All right. First of all, I would say one of our major challenge is resources. So, and when I talk about resources, I talk about human resource. I talk about other aspects in terms of material things, because you also bear me witness that for some of our institutions, whether at the health institutions or even in the school, we may not have a number of enough hands. For us at the health institution, we have to cater for people that comes to the clinic. But taking care of the adolescent, we still have to go out to go and meet them. Some of them that are out of school in the community, to meet them, some of them that are in school. So that tells you that we need more hands, because the few people at the facility, you cannot move them out. But some other people are still coming to facility too. So it's a major challenge. And then another challenge is the issue of having access to schools. But I still want to give kudos to Ministry of Education. They are helping in this area, but we still need more collaboration so that the school can be accessible for us, even to bring some of these health interventions and messages to them. And then also, like I talked about resources, there are a lot of programs that we need to make sure is available for them. Government has to have that political way, have that resources on ground for them. For example, we have been talking about menstrual hygiene to this our adolescent girls. They have to have facility in their school where they can change during their menstrual time, so that they will not, because of menstruation, run away from school. The school has to have what we call like a pad bank. Some of them were asking us questions in the course of the week when we were talking to them that what do I do if my flow just come I didn't prepare for it. It just come in schools. That means there must be something like an you prepare for them. That's like an emergency. It happens to adults too. Women can also bear me witness. So at least that girl must have something to back on, a pad for her to just change, a toilet, a clean facility for her even to clean up. So a lot of resources have to be put. We have to be intentional about it. Government has to be intentional in budgeting for adolescent health. That's where I'm going. There must be an intentional heart about it, because this is a critical hit that every resources that we are putting to the childhood health may not even we will not have a good result if we forget that range, that age, that transition where they transit from being a child to adulthood.
All right, you said earlier that you do reach out to some of the out-of-school girls, and how is the acceptance rate like from those girls?
So that depends on, it depends on the community. Okay. Some communities are receptive, some it may not be that easy, or it may not, depending on how acceptable is the community. But what we have always been doing is to go through the gatekeepers in the community, people that even owns the place. We have our health promotion officer in all our HGAs. So they have been on ground, they know the terrain, they know the people. If you want to enter this community, you go through this and that. So you don't just go to them straight away, you go through the gatekeepers in the community.
All right, let's talk about mental health now. Mental health is part of this year's theme. What specific initiative have been carried out to support adolescents' mental well-being?
For now, basically, this is one of the things that we are doing, awareness. Parents need to be aware. There have been a lot of issues of news people will also, journalists will also bear me witness, a lot of cases of adolescent teenager committing suicide in our society now. So enough of parents seeing them as, what is he thinking about? What is his problem? They have a whole lot of issues they are also going through. Some of them as simple as their physical makeup, the way they look, give them concern to the extent that they enter into depression. Some of them are being bullied. Some of them are being violated. Some of them are being threatened not to speak up. So they harbor a lot of things inside of them. So on the issue of mental health, what we have been able to do is to talk to them and talk to parents also. Talk to teachers. Give them a space. Give them a voice. Let them be able to voice out. Let them be able to, let's be motherly enough to let our girls talk to us about what they are going through. It eases them off of those mental tensions. Then another thing we have always been telling our adolescents is they need to rest. They must take enough time to sleep. Some will be on the internet, some will be on phone till midnight, and you still have to go to school the following morning. So they must give themselves, they must make sure they have enough rest and they are not into drugs. It's a major thing. If you are into drugs, you are as close as anything to mental health issues. So they should stay away from drugs.
All right, you talked about government being intentional about helping these adolescents. What kind of support, how would you rate the support your office has received so far from the government, NGOs, or international partners?
All right, so far, in fact, is becoming better because we begin to see a lot of partners and CSO now looking at the side of the adolescents, because we begin to see that these young people, we need them. We need their voice. We need to really take care of them. So some of our partners have been doing well. Government on their home part have been doing great, because one thing about health is encompassing the set of the adolescents that we talk about. Also, they are also benefiting from everything that is available at some of our facilities. And for us in Osun, we give kudos to UNICEF. UNICEF has been helping a lot to make sure that we are exposed, even as the personnel that is going to drive the interventions are being equipped with a lot of trainings and with a lot of support and also outreaches. So you don't sit down and think they will come. You go out and meet them, and also make our facility to be adolescent friendly. So a lot of our partners, WHO's, UNICEF, and a lot of them I really don't. We advocate for more.
Oh, right. It is believed that so many programs starts and ends with research. How do you monitor and evaluate the impact of adolescent health interventions?
All right. Yeah, you know, for every programming, for every program that is part of it that we call monitoring and evaluation. And we have is a major aspect in our head. It's a major unit where everything that we do in all our interventions, we have to evaluate. So we have different data tools that we use to capture every interventions that we give. For example, if you go for outreaches, how many girls were reached? How many boys were you able to speak to? So if I go for outreaches and I talk about HPV vaccine that prevents cervical cancer for girls, okay, after we have spoken to them, we provide that service. So how many girls were vaccinated? So by that, we'll be able to track how many interventions have been able to give, how many people receive the services. Then we also report cases like gender-based violence among adolescents. So in our hospitals, per month, how many gender-based violence were reported that is at that bracket age of adolescents, how many of them receive treatment, how many of them. So like that, we'll be able to monitor and evaluate. And then some other partners go into research also, where they go to community, collect data, and do all
so far, what's your assessment on some of the recent intervention programs you've undertaken?
So my assessment so far means that we still need to do more. There are a lot for us to do in the space of adolescents. This week of that we commemorate International Adolescent Week, we have been to school. Adolescents were given opportunity to ask questions. And I can tell you a whole lot of sensitive questions that we couldn't finish, we couldn't exhaust. And not only that we couldn't attend to all those questions alone, they are sensitive questions that you cannot imagine that is coming out from this set of guys. And so it's a pointer to us that I see a lot of things that all of us together we need to, as a teachers, school counselors, parents, especially parents, there are a whole lot of things that we need to put in to ensure. And in the course of the week, we also, with the support of UNICEF, gather our girls to even look at how creative they can be. Sing songs to promote HPV vaccine, fantastically using our girls, composing different songs and being creative. So it's been a wonderful time.
All right, looking at the future, what are your priorities or plans for improving adolescent health in the coming year?
Oh, in the coming year, we are looking forward for more support from all our implementing partners, donors, philanthropists, because we want to look beyond reaching out to our adolescents in schools. We want to reach out more also to those of them that are out of school. Some of them are out of school because they are pregnant. But that does not mean they are no more adolescents. They are still an adolescent. So we still need to pick them up, probably empower them, give birth and go back to school, or learn in school, whereby we eventually reduce the issue of gender-based violence in our community. And also, we don't want to leave anyone out. The adolescents that live with disability, they need more attention. So we are looking forward for more support from our government, for our donors, to help us to reach out to them. All NGOs and CSO that work in the space of adolescents, is a time that we really move out to meet them, those ones that live with disability, those ones that are out of school, not only those ones that are in school alone. So we are looking forward for more collaboration from every stakeholders. Yeah.
All right, we have been speaking with Mrs. Roseline Akinlabi, the Adolescent Health Desk Officer, Osun State Primary Health Care Board. Thank you very much for coming on the news.
Thank you, sir. It's nice being here.